How to provide recommendations or interventions to your doctor. We pharmacists sometimes are insecure about our knowledge. We doubt ourselves. Not all of you, but there are some of you. We are so anxious to talk to a doctor. We are so anxious to present a recommendation or intervention, thinking, are they going to accept us? Or are they going to confuse us by asking so many questions back? Or maybe even mock us for what we say. Remember one thing. If you are a pharmacist, you are the guardians of medicines, guardians of safe medication use. After this video, you will be able to confidently present your recommendations or interventions to your doctor. So keep watching. Hi, my name is Fatima Shamin. I'm working as a clinical pharmacist and research fellow. I do videos regarding pharmacy, medicine, health, lifestyle, productivity. If these contents interest you, you can subscribe to my channel. Welcome to my channel. A doctor, nurse, or pharmacist. All of you are healthcare providers. In one way or another, you are helping a patient to recover from his condition. It's high time we consider each other as colleagues in this noble of all professions. A true doctor or a true healthcare provider is concerned about the well-being of the patient. So, make the time to communicate better as professionals. Change starts with improved communication. First thing. So you need to develop the skill of attention to details. So I have an entire video regarding this. You can watch it. The link is below in the description box. So if you have that skill of attention to details, you can find out medication errors very easily. So in this video, I'm not going to talk about how to find medication errors. I'm just going to help you how to present your recommendations to doctors in a professional way. So first thing, plan your conversation. So you know, right, physicians or doctors, they are busy always. So maybe the maximum time they can spend with you maybe will be around 15 minutes, hopefully. So you need to keep in mind, like, prioritize the things you want to say. Create the list of topics you want to address. So if you have a recommendation, you need all the details regarding the patient also. So keep all your information intact. Write it down if you can't remember well. So keep all that information in hand. Along with that, back up your recommendations with evidences. It can be guidelines or it can be clinical study trials. Just remember, published data should suggest 90% or higher. So keep all your evidences or guidelines in hand. You can take a printout if you want. So always remember, back up your recommendation with evidences. That's how it works. So once you plan your conversation, you have to be ready to present it in a professional way to your doctor. You cannot say to your doctor, the XYZ medication which you have prescribed to your patient is a wrong dose. You have to change it soon. Otherwise, it is going to cause this problems. This is not the way. Now, what is the right way? You can follow this method. IP bar method. I stands for introduction. P stands for patient information. B stands for background. A stands for assessment. R stands for recommendation. So let's start with introduction. So in the introduction, you are going to introduce yourself. For example, hi, I'm Dr. Fathima. I am a clinical pharmacist under infectious disease department. Or such a way, you have to introduce yourself within one line. That's it. Next is patient information. So doctors usually remember their patient by their age, or sometimes by their condition. Most importantly, they remember by their condition and age and gender. So make sure you have that with you. So you should have the patient gender. You can have the patient name, the gender, the age, and the clinical condition, and your details regarding your recommendations. So talk about your patient. Start with his age, his gender, his condition, and what is your recommendation. So that is background. So background can be okay. So this was the medication you had prescribed for the patient under your care, and then you can tell regarding your evidence according to this and this guidelines. This can be this, that can be that. So whatever is it, I will present it to you with an example. So that's how you provide your background of the patient. Then you give your assessment, like we can change the dose from this to that. That way you can present if it is a dose change, or if it's an adverse drug reaction or a change of drug, you can provide the intervention as such. Then you can provide your evidence. It's according to this guidelines, or it's according to this data. You can provide your evidence. Then you provide your recommendations. And after that, you should never hesitate to ask questions. You can ask questions if you're doubtful about something you have presented, and you can also ask their opinion about the recommendation. So let's see how IP bar method works. So I have done my antimicrobial stewardship program in tuberculosis. So I'm just giving you an example of that. So, hi doctor, I'm Fatima. I'm working as a clinical pharmacist in anti-tuberculosis treatment stewardship program. I would like to talk about the patient under your care, Mr. XYZ, 60 kg. He's a case of TB spine and CKD stage 5. So currently the patient is on HRZE regimen with XYZ dosing. So my recommendation is that according to the NTEP guidelines, which is the National Tuberculosis Elimination Program guidelines, this is the dose range for the drug ethambutol. So currently ethambutol is overdosed for this patient. As per the guideline and as per the body weight and calculations, this dose would be ideal for the patient. So nowadays, optic neuritis is seen in many patients. So we also recommend an ophthalmology consultation for this patient. And then you can say, what do you think about this recommendation, doctor? Is it okay for the patient? So this is how you present your recommendation. And this is how I present my recommendation. And we have got a higher amount of successful rate regarding the acceptance of recommendations, which is good. So I'll tell you, frankly saying one thing, not all doctors are going to accept it, because since the prescription pattern is different for different doctors. But I'll say you, there are so many other doctors who really accept the recommendations which we provide. Don't worry about the outcome, whether they're going to accept it or reject it. As a clinical pharmacist or a pharmacist, it's your duty to provide the correct medication to the patient. So provide your recommendations confidently. Your role is also to provide adequate patient care. You are also the part of the healthcare team. So remember that. Your role as a clinical pharmacist is to provide adequate patient care like them. But the way is different. You check prescriptions, you check for medication errors, you check for the ideal therapy for the patient. So be confident, do your work, and don't worry about others. I hope now you have some confidence to provide recommendations or interventions to your doctors. I hope this video was informative for everyone. Share it with your friends who need this, and it is going to be very useful for students. Thanks for watching. Don't forget to subscribe. Have a nice day ahead.